Today we start a new, let's say, module, viral infections. And I want to ask you, how do you think which kinds of pathogens we have more in nature? Viruses, bacteria, or fungi? Do you have more in nature viruses, bacteria, or fungi? Who is for bacteria? Please raise your hand. Who is for bacteria? Who thinks we have more viruses in nature? Who thinks we have more fungi in nature? We don't have to evident the majority. Could you give me some reasons why you think we have more bacteria in nature? Who thinks we have more bacteria? Wamik, what do you think? Who thinks we have more bacteria in nature? How do you think? Why do you think so? Why do you think we have more bacteria in nature? Who thinks we have more viruses in nature? Why do you think we have more viruses? One more time, please. Virus cannot even survive without host. This is why we have in nature more bacteria or more viruses? Bacteria. Okay, we have an argument in favor of bacteria. Do you have any arguments for viruses? No? Well, it's interesting when you give a right answer, it is harder often to give an argument for that. And if you are giving a wrong answer, here we are, we have a lot of arguments. Of course, there is a chance we can be wrong for a simple reason: we didn't study all the microorganisms existing in the world. So our science is not familiar with everything we have in the world. Every day can be discovered new genuses, species, families, so on. But as well as we know for now, the mostly prevalent in nature are viruses. And here how we can explain it, or how can we prove it? How many times in your life you've been infected with anything? A lot. Now try to remind how many times in your life you've been infected with a viral infection. And how can you know it was a viral infection? For example, how many times you got flu? Or any other acute respiratory infection? I guess almost all of us, we get infected with acute respiratory viral infection every year, and maybe not once, right? Can you remind how many times during the last year you've got infected with a viral infection? Maybe 1 or 2 times, probably, right? Have you been infected with a bacterial infection? Ever? Probably yes. How many times? You also can remind that we had a few episodes in our life, but not that often as viral, right? Already we have very approximately statistics of incidence and prevalence of infections just based on our health. So I know that I've been infected with the viral infections for a lot of times in my life, and I know that I've been infected with bacterial infections for a few times in my life. Have you been ever infected with a fungal infection? Maybe, but not everyone. So you can observe how many times in your life you've been infected with a viral, bacterial, and fungal infections. And you will observe that the viral infection will be on the first place. So if you will ask everyone, if you will give to everyone the same question, you will receive quite similar response. That most of people have been more often infected with viral on the first place, and on the second with bacterial, and on the third place with fungal infections. Now, why people get infected with viral infections more often than with bacterial? And here we should pay attention to the way of infection. Most of viral infections, not all of them, some viral infections are spreading by different ways, but most of viral infections we ever have in our life are spreaded through the air route. This is the first reason. Even if the virus is not able to survive outside the host cell, even if virus very often is more vulnerable to the environmental conditions, to the environmental factors. They are smaller, they're light, and they can viruses can spread better, faster, and it is like the dose of infection is smaller. That's enough, a smaller amount of virus in order to get infected, in order to get sick. And viruses are multiplying in the exponential progression, very fast. One virus attacks one cell, and one cell produces hundreds and thousands of viruses. Meanwhile, few bacteria that can get in our body, not all the time will cause an infection. It will depend. Is it conditionally pathogenic or mandatory pathogenic viruses? Bacteria, excuse me. So, most of viral infections are airborne infections. But you must make difference between airborne infection and respiratory tract infection. Because not every airborne infection is respiratory infection. There are some infections that are spreading through the air, but they do not affect, the pathogen doesn't affect the respiratory tract, the respiratory system. And today we will discuss both. The first one is flu. And before we will start discussing specific infections, specific pathogens, I would like to ask you, can you make a difference between viral and bacterial infection? Because respiratory ways can be affected by both bacteria and viruses. So can you make difference between bacterial respiratory tract infection and viral one? It is very important to know the answer on this question, because when you have a patient and you must prescribe first of all investigation and after that treatment, in order to prescribe the correct investigation and in order to prescribe the correct treatment, because you must know that for viral infection we have one kind of investigations, and for bacterial infections we have other kind of investigations. For viral infections we have one treatment, for bacterial infections we have another treatment. For example, if we have a bacterial infection and we don't treat it with antibiotics, the treatment will not be successful enough in most of cases. Just very few bacterial infections can be healed by its own. Our body can fight it on its own. Most of bacterial infections, especially respiratory tract infections or generalized infections, are treated with antibiotics. But if we have a viral infection, of course, we shouldn't prescribe antibiotics, with some exceptions, and we'll discuss it later. So, in order to prescribe the correct investigation and correct treatment, you must make difference between viral infections and bacterial infections, apparently. So you have a patient, how you make difference? A patient with catarrhal symptoms, affection of respiratory tract, how you make difference between viral and bacterial infection? First of all, what is in common? Every inflammatory process includes those 5 signs: tumor, rubor, color, dolor, functiones. So, inflammation, redness, pain, local increasing of temperature, and dysfunction of affected tissue. This is what is in common between both viral and bacterial infections. Now, which is the difference? Fever also can be in common, but increasing of temperature, color. But it can be local and it can be generalized. It depends on type of infection. What is different between viral and bacterial infections? In viral infections, we will not have any extra signs, just those 5. That's it. No changing in smell, and bacteria are giving smell. We already discussed it. Bacteria, correct? That bacteria is giving the mostly specific, strong, and let's say awful smell or stinks. Especially both pathogenic, conditionally pathogenic, non-pathogenic saprophytic bacteria and fungi also. When they multiply and they process the organic substance, they produce this specific smell. Viral infection will not produce that specific smell. Second, if we are talking about respiratory tract infection, or we are talking about, if we are talking about bronchitis or pneumonia, we'll have expectoration during the coughing. The cough will be productive with some pathological material. So if the sputum the patient produces is transparent, it is probably a viral infection. If it has a kind of greenish or yellowish color, if it is not transparent, it is colorful, it is bacterial infection. Same thing with mucus from the nasal cavity. It will depend on bacterial or it is bacterial or viral infection. It will give or not a color. Bacterial infection in tissue produces pus. Viral infection will not produce any pus. So purulent processes are characteristic only for bacterial infections. In viral infections, we never have it. If we are talking about sore throat, about tonsillitis, inflammation of tonsils, it can be also viral one and bacterial one. Viral one, just as I told, will give just inflammation and redness, apparently, but bacterial one will give white spots. White spots. Sometimes even kind of stones, but basically white spots, pseudomembrane it's called. So there we also should differentiate, for example, between tonsillitis and diphtheria, because there are some differences, but it is another topic we already discussed. So this is how apparently you already can know, is it viral or bacterial infection? Okay, you know, is it a viral or bacterial infection? That means you according to the symptoms, you can appreciate which disease we have. You can guess. You don't know 100% unless you're making lab investigation. So the first step, we appreciate it by appearance. After that, we prescribe some lab investigations based on our knowledge, based on symptoms, based on all the circumstances, maybe epidemiological situations. If we have an outbreak of some specific infection, we will pay more attention in diagnosis, in investigation. We'll pay more attention to the mostly popular or mostly common infection for this moment and for this region. This is what I told in group, that if you can hear outside kettles running around, you just hear them, you don't see them. You probably imagine horses, but not zebras, right? Why? Because they are not specific for our area. So if you can hear sound of kettles running, you can imagine horses, you can imagine cows or something like that, but not zebras or elephants. Just because you know it is not that specific here. This is why when you become doctors, you should start from the mostly common infection to the less common infections. Don't you think that you will start investigating extremely complicated and rare diseases like in House MD TV show? In the real life, medicine is much more boring than you think, and you should understand it. So you start from the mostly common to the less common infections. This is how you detect it, and you will treat it faster. It makes more sense. So we start probably with viral infections. We appreciate all the symptoms and epidemiological situation in other circumstances, and we make lab investigation. Now, what is important to know about any viral infection that affects respiratory tract? The treatment will be similar. Flu, influenza, parainfluenza, coronavirus, adenoviral infections, all of the acute respiratory tract infections, viral respiratory tract infections, will be treated in the same way. And in most cases, we don't really need etiological treatment. It is enough just symptomatic treatment. What does it mean? In most of cases, antiviral drugs are not needed. Like, you can apply them. It doesn't mean antiviral drugs are useless. They will produce an effect. But the issue is that if you will not apply antiviral treatment, but you will responsibly apply symptomatic treatment, you will treat this infection in quite the same period of time. Between 2 or 3 days up to 1 week takes to treat most of acute respiratory tract infections, viral infections. So if you take the treatment responsibly, and you treat all the symptoms, including tiredness, that is treated only with rest and nothing else. That means if you are sick, you should take rest and take all the rest of symptomatic treatment. It will not differ from infection to infection. So why do we make lab investigation for such infections if the treatment will be the same? Basically, for treatment in such infections, we don't need any lab investigation. Not for treatment. Why do we make this lab investigation? How do you think?
So how we found that we have COVID?
Yes. So, what you should keep in mind, that lab investigation is made not only for treatment prescription. Lab investigation is made for statistics. How can we know we have pandemic? We check it out. How many times, another question. How many of you got infected with flu last year? Could you? Who've been infected with flu last year? Okay. How many of you made lab investigation for flu? I can see only one hand. It was Did you make lab investigation for flu and you got a positive result? Yes? Or not? So another question, how can you know it was flu? But not, it was influenza virus, but not parainfluenza virus, or not coronavirus, or adenovirus, or something else. How can you know? And the truth is, unless you are doing lab investigation, or at least express test you can buy in pharmacy, you never know. Did you go at least to a doctor? Hopefully. Because not all of you went to a doctor, and after that some of you came here, and after that I've got infected, my wife got infected, and my child got infected. From that time I am that angry on you. Okay? So, you never know which is the infection unless you make lab investigation, unless you make checkup. So, you make checkup, you make lab investigation for statistics. In this way, you know which is the incidence which is morbidity. How many people get, how fast infection spreads, how many people get infected every year. Another question, how many people are dying every year because of flu? According to the WHO data, between 250,000 and 600,000 people are dying every year because of flu. Is it a lot or not? It is a lot. Population of our city is about 600,000. So every year, something between half and entire Chisinau are dying because of flu. If we compare as a population. Is it a lot or not? From this point of view, it's a lot. But if you take into consideration that it is under 1%, because more than 1 billion of people every year are getting infected because of flu, we can say it is not too much in percentage, but actually it is too much. And how many people are getting infected with flu? Nobody knows. Nobody knows, because just as I asked you, how many people got infected with flu last year? A lot of hands. And how many of you have been made lab investigation? Just one hand. So actually, in most of such cases, lab investigation for flu is made only post-mortem. That means after a patient died. And we can just appreciate how big is percentage. But we don't know, we can appreciate it by previous checkups when flu used to be pandemic. Because we also had such situation, like with coronavirus, we had with flu, Spanish flu. It is that flu we have every year. So this is what happens with coronavirus. Same thing. It happens again. And it will stay with us, I guess, forever, just like flu. So every year we will have a chance to get a shot against flu, against COVID, against any other season infections. Which are symptoms of flu? Because it is very important, just as I told you, for such infections, symptomatical treatment is enough. But a lot of people are thinking, okay, for flu, symptomatic treatment is enough. So, I have fever, I take paracetamol or ibuprofen or something like that. I have fever, I have headache, maybe I have tiredness, I have, what else? Running nose, I have... And they treat all of these symptoms with some Theraflu, yes, or some paracetamol or ibuprofen, some tea, because everybody knows that we have to drink a lot of hot drinks, yes, correct, and that's it, right? Maybe some droplets in the nose to stop running nose. Hopefully, at least half of you will wear the mask. And how many of you will stay home? Not too much, because you will have to recover a lot, right? So, what are you doing? Are you treating all the symptoms? No, because one of the most important symptoms is tiredness that is treated only by rest. And if you don't stay home, you don't have rest. If you don't have rest, you didn't complete your treatment. This is extremely important. And when you don't complete your treatment, there is another chance to get a super infection. how it happens. You're already sick. You already have symptoms of acute respiratory tract infection. So it is not surprise for you that you are infected, that you are sick, right? You don't treat your infection completely, just as it to be. You don't apply complete symptomatic treatment. About antiviral treatment, we are not talking at all, because Theraflu, sometimes it is the only thing you apply. So such caps very often are filled with, not with tea or coffee, but with such powders mixed with water. And this is how you treat your flu or your acute viral infection. So you already know you're sick. Meanwhile, in all of us, in our respiratory tract, we have non-pathogenic and conditionally pathogenic bacteria. Mucus production increased, so conditions for multiplying for bacteria will increase. Inflammation already is there, and conditions for conditionally pathogenic bacteria are better, are more proper conditions. So here starts bacterial infection. And what you should keep in mind, bacterial infection that comes above the viral infection all the time will be much more aggressive as nosology, as manifestation. It will have more severe symptoms and more severe consequences. A simple example. Why it is that important to pay attention, especially to children? Because even adults do not have too much responsibility in their own treatment. But children, they even are not able to ask for a treatment. They simply don't feel good enough, but they are not aware about the fact they need a treatment. Finally, if it will be too bad, if it will too hurt, they will cry, but they will never ask for something. Give me some pills or give me some treatment. Even teenagers, they do not have that responsibility for treatment. So you grew up when you start to treat yourself by intention and for your own money. But teenagers will never do that. Kids will never do that. This is why it is extremely important to pay attention. Here's an example. A kid about 7-8 years old have been infected with flu. It was fall, it was autumn. His parents, as it happens in our country, have been abroad for some money catching. This kid was old enough to take care of himself, to wash himself, yes, to wake up and to eat something, yes, but to take care of everything, not really. This is why his aunt have been visiting him maybe once a day, maybe once in 2 days or something. Is it enough for a kid? Of course not. He got infected with flu. He's been walking around with his classmates from school. Of course, he didn't take any treatment at all. After that, he got a super infection with bacterial pneumonia. An ambulance in one night is somebody walking around his house finds this kid on the ground, they take ambulance, they bring it in our hospital, unconscious. Doctors are doing everything that is possible. Over 1 liter of pus is extracted from lungs. Over 1 liter, yes. And of course, it wasn't any chance for that kid to survive. So he died. Such cases happens every year. And just as I told, just post-mortem, after death, we discovered that kid was infected with flu. Flu was the reason of death? No. It was the beginning of the issue. It was just the first step. But unless we take responsibly all the small issues, we'll never solve big issues, because everything comes step by step. Everything develops. It never happens at once. So this is why it is that important to pay attention, especially to such light infections, because the mostly dangerous enemy is not the strongest enemy, but the underestimated one. So all of us got infected with such infections during our life for a lot of times, but still we are alive. This is why we are exposed. We are more exposed to underestimate such infections, to not treat them completely, to not pay attention to all the dangers we have around these infections. And this is what gives place for complications, for superinfections, for severe form of infections, and for increasing of mortality. How flu manifests? One of the mostly specific symptoms for flu, specifically for flu, is running nose, because this virus starts multiplying mostly in the nasal cavity and not too much in the middle or lower respiratory tract portions. This is why flu doesn't produce pneumonia that often, but it can give a start, it can give a place for bacterial pneumonia, just as we discussed. This is how we make difference with the same coronavirus that we had recently. For coronavirus, more specific, it doesn't mean it doesn't affect at all, but more specific are middle and lower parts of the respiratory tract and respiratory system. This is why coronavirus is able to produce viral pneumonia. This is what makes coronavirus more aggressive, that increases severe forms, a number of severe forms, and as a result it increases mortality. Like if we have under 1% mortality in flu, in COVID we have about 3 up to 5% mortality. It depends on variant of virus, type of mutation we had. For example, hospital in which I'm working, during the first year of pandemic of working with COVID, exactly 100 people got infected and 3 died. Yes, I'm talking about my colleagues from our hospital. So exactly 100 people got infected and 3 of them died. This is a real statistic. This is a real statistic of mortality for COVID. So whenever you're asking, is it real? I can appreciate from my own professional experience, it's real. Lab investigation for viral infections. is very common. The mostly common will be either antigenic test, either molecular biological test, that is PCR, and sometimes we apply culturing on cell cultures, but it is not that common in outbreaks. In outbreaks, as faster we detect it, as better it is. And again, just for statistics, not for treatment. Treatment, just as I told, symptomatic treatment. And on the first place, I would put rest. In such infections, on the first place, I put rest. Liquid replacement, because please keep in mind, in viral infections, you don't really absorb, but you really lose liquids. By breathing, your body temperature increases, and by breathing, you will eliminate more water. Your body temperature increases, so in some periods, you will have sweating. You also lose enough liquids. And you will not really absorb, but during inflammatory processes, urination also very often will increase. So you're losing a lot of liquids. And as less liquids you have circulating in your body, as more comfortable it is for virus, as more complicated it will be for your situation. This is why it is that important to drink enough hot drinks, because you lose a lot of liquids and you lose a lot of energy you need for recovery. This is why it should be hot, and this is why it should be sweet, because you lose energy, you lose liquids, your body fights. Your body needs this energy and these liquids for fight. And other symptomatic treatments, like decreasing of fever. What is fever? Everything above 38 degrees Celsius. It means if we have subfebrile temperature between 37 and 38, it is not mandatory to apply antipyretics. But if it hurts, if you have headache and other symptoms, of course we are not waiting and we apply these drugs, because antipyretics, they actually have triple function: antipyretic, analgesic, and anti-inflammatory. So if you have two other symptoms, if you have headache or you have inflammation process, pronounced inflammation process, in this case, of course, we apply such drugs. But if everything is light, we can wait for a while. Maybe it will be solved by itself. It happens. But if not, and the temperature will increase up to fever, of course, we should treat it. Regarding antibiotical treatment, I told you that antibiotics are useless for viruses, for viral infections, but just as we discussed, in some viral infections, since we don't pay attention too much to this infection, it happens, we have superinfection, bacterial one. And in such cases, of course, we apply antibiotics, because in this case, without antibiotic will not solve the issue. So that means at the same time it is absolutely useless treating viral infections with antibiotics, but at the same time, if we have a superinfection, we will not solve an issue without antibiotics. This is why in some, especially in outbreaks, antibiotics are more widely used in viral infections. Not because doctors do not know that antibiotics are not for viruses. But because we have a lot of complications, we have a lot of superinfections, our body is more exposed for such infections. Prevention, it is very important to keep in mind that the best way of prevention of airborne infections is vaccination. Medicine, science, people didn't invent anything more effective and more efficient than vaccination for airborne infections. For other infections, vaccination not all the time is the best option. It's a good option, but not the best one. But for airborne infections, please keep that in mind. Vaccination is the best thing you can ever propose. Because we have masks, we can wear the mask, but it's not 100%. We can disinfect anything, we can sanitizing our hands all the time. It is very good, but it doesn't help 100%. The best option actually is to apply all together. Like, principle of Swiss cheese. As more filters you have, as more chance you will solve the issue. If you have just one, every side has its holes, its weak parts. So if you put a lot of filters, that means vaccination, masks, distancing, isolation. Can you imagine that just by taking rest you solve a lot of issues? You don't get out while being infected. You don't infect others, and you recover faster. You localize the source of infection, which is you, and you recover faster. You get well faster. It is very simple and it is very efficient, but it is almost impossible for a lot of people because people used to think that they are smarter than everyone. So if government says to do something, it is because they want us to think I don't know what. If doctors are saying something, it is because they want to make money on us. Of course. Yes, we do. So everybody has his or her brilliant idea about how to solve the issue instead of listening for those who know a little bit more. Yes. This is why prevention is extremely important. But when we are talking about such infections like flu, like coronavirus, all the respiratory tract acute viral infections, it is quite enough to vaccinate people who are getting in contact with a lot of people. Doctors, teachers, professors, sellers in the public places, and so on. If my activity means to have a big contact, to have a contact with a large amount of people, like me. Today we are supposed to have here 221 students. Of course, not all of them are here, but still over 100 for sure. So it is very important for me and actually for all of us to get to be vaccinated, because we gather in crowds every day. Some people, they stay home, they don't need it. They do not contact with a lot of people too much. They don't need it too much. They can do it, but it is not that necessary. But when it becomes pandemic, there is no chance to avoid it. All of us are breathing. without breaks. This is why when it is an outbreak, it is extremely important for everyone. When it is something like sporadic, that's enough just for those who are contacting with a lot of people. And of course, hygienic measures are extremely important. Also, we have some infections that are also airborne infections, but not respiratory tract infection. If we are talking about measles, it is airborne infection. It spreads through the air, but it doesn't affect the respiratory tract. What it affects? Skin and mucous membranes. How can we know it? We can know it by symptoms. This virus affects skin and mucous membrane. By symptoms you can see how it manifests, and it is characteristic especially for children. By rashes on the skin, eruptions. And how can we know it affects mucous membrane? Because we don't have too evident picture on the mucous membranes in measles. By the way of spreading. How it spreads? It is airborne infection. So oral mucous membrane is affected with the virus. And while talking, while breathing, while coughing, and it is not necessary to be sick in order to cough, right? We can cough and sneeze every day without being sick, because coughing and sneezing are reflexes of irritation, and irritation can have different genesis, not only infectious one. It can be mechanical irritation. So during the day, I can cough or I can sneeze just because something irritates my mucous membranes. During this, or even talking, if I'm talking a lot, during talking, more particles are running out from my oral cavity, and there is a higher chance for me to infect anyone. With extremely small particles of saliva, of mucus, this virus is getting out from the source and getting to receptive organism. Extremely important mention, receptive one. What does it mean? Prophylaxis, immunoprophylaxis. That means vaccination. And just as I told, airborne infections are preventing mostly, efficiently, by vaccination. This is why in our immunization program, if you will check out for curiosity, immunization program of Moldova, of India, of any other country you are coming from, you will observe that most of vaccines are against, not all of them, but most of them are against airborne infections. Either respiratory ones, either airborne infections like measles, mumps, rubella. All of them do not affect the respiratory tract, but they are transmitted through the air. So the best way of prevention, just because all of us are breathing all the time without any breaks, we are talking, we are coughing, we are sneezing, we contact to each other. This is why vaccination is extremely important. So prevention will be with triple vaccine, vaccine against measles, mumps, and rubella virus. All of them are viral infections, airborne viral infections. And also we have mumps. In Russian, popularly, this infection is called, if we translate it, kind of pig, because of symptoms. If you ever saw a kid with mumps, usually it is just on the one side. It affects parotid gland, parotid salivary gland, and it inflames it, but usually just on the one side, just as you can see it. Parotid glands means it is nearby ear. So when it inflames, normally it looks like this. It is small, and it produces saliva. It is salivary parotid gland. So its opening is in the oral cavity. Inflammation is going in all the sides. This is why it is called, it looks like a pig's neck, that actually passes from head to shoulders, just because of this inflammation. So the virus is accumulated in this parotid gland. This is the reason it spreads through the air with saliva. It is very easy to diagnose it by symptoms, but of course lab investigation is also important for reasons we already discussed. And this is how it looks from the inside. The inflammatory processes goes outside and inside of oral cavity. So in order to obtain some samples for lab investigations, it is important to open the mouth to get a comfortable access to the parotid gland, and with this spatula to press a little bit the gland. And this is how you obtain saliva with virus. So by this prelevation method, you can obtain virus for viral culture. You can obtain virus for antigenic test. Whenever we are talking about tests for antibody, please keep in mind we collect as a sample blood. When we want to find the pathogen and its antigens, we take prelevats from the affected area. But when we want to find antibodies to check, why do we take a test for antibodies? To check, is the child immune or not? What does it mean? Or the patient is immune or not? That means either we had acute infection now, either we had infection recently or a long time ago. It depends, IgM, IgG. IgM is for recent antibodies, IgG are old antibodies. That means disease happened a long time ago. Either if a child or a patient is vaccinated. So by antibody test, we can appreciate immunity, or did the person have infection or have been vaccinated. But if we want to diagnose infection right here, right now, it is important to make either antigenic test, either molecular biological test, that is PCR, either either virological test that includes cultivation of viruses on different cultures like cell cultures, embryonated eggs, or lab animals. It depends which virus we investigate. And also, just as you can observe, most of these viral infections are not treated with antiviral drugs. It is rest, it is hydration. Why is that classical? Because during viral infections we lose a lot of liquids even if we don't observe. And they're drying our body and they multiply better in that way. We need to replace the liquid in order to help our body to fight with viral infection more efficiently. This is why hydration and rest are that important, and all the rest of symptomatic treatments. And prevention is the same. Extremely important, promotion of vaccination. Whenever your colleagues, your parents, your brothers, sisters, relatives, friends, neighbors, whoever are asking you about vaccination, you shouldn't discuss too much, because it takes over 10 years to get a degree, to understand all the particularities, all the features, all the nuances and moments that includes vaccination and treatment. It takes a lot of time, so you will not be able to explain to your friends or relatives everything about that. But you should understand for yourself and for your professional future that vaccination is extremely important. And unless doctors will understand it, the civils will never understand it, just because it happens that we have different opinions on that topic between colleagues. It shouldn't be like that.